my name is Dr. Andrea Ellis here at Meadows Chiropractic, and today I just want to talk about head forward posture. And so it's something we talk about a lot, and not a lot of people know if that's something they're struggling with or not. And in all honesty, most people are, but to the degree that they have that head forward posture varies definitely, depending on your age, previous accidents, and what you do for a living. How I show my patients what's going on with their head over their shoulders is I tell them to get up against something flat. So I'm going to show you with this door because it's more easily seen than with the wall. But basically put your back up against that flat surface, the wall, the door. Get your booty, get your mid back up against that. Your feet don't have to be up against the door. You just want them under your hips. And then just stand tall and straight. And then once you feel like you are at your best posture, evaluate your shoulders and evaluate your head. Can your shoulders go back? I know mine can. So I definitely have some shoulders that are rolled forward. And again, can I put my head back? I can, probably about maybe between 1 inch and 3 inches. I can't measure that behind me, but so I do have some head forward posture. So where does that come from? It comes from being in a continually flexed position, sitting at a computer, number one culprit, driving for a living, standing, leaning forward, people who are cleaning, cutting hair, chiropractors, plumbers, pretty much almost everything requires that we lean forward and do stuff. So that's going to create that head forward posture over time. And even how we sleep and sit. If you're sleeping on your back with 10 pillows behind your head, you're bringing that chin to your chest. I know one of my vices is being in a nice tub for long periods of time. And so when I'm in that tub, I'm in a flexed position. So that creates this postural issue over time. So how do we work with that, and what does that look like? When we're in our office, we adjust necks, we adjust upper backs, get all of that moving again. We do muscle work of the neck, at least in what I'm doing, but we have massage therapy. So our massage therapists are trained to work on that neck, right under the skull, the shoulders, and even across the chest to loosen up these chest muscles. Strengthening that backside, because as we roll forward, these muscles get really tight and our upper back is usually pretty weak. So strengthening that upper back, things like doing rows is gonna be helpful. Doing lat pull downs are gonna be helpful. Anything that's strengthening, anything where those scapulas are moving, we're gonna see some strengthening in that area. And then stretching of the pecs, getting in a doorway like you see here, putting your arms here and stepping through that and stretching those pec muscles. So what does it look like when you have head forward posture? What symptoms do we see? Neck pain, easy one. Jaw pain, ear pain, eye pain, because the nerves of the neck innervate all the stuff in the head. So most of our head symptoms come from that neck. Things like headaches, tension and stiffness, all of those things. So if you are struggling with head forward posture or any of those symptoms that I mentioned, do please make an appointment in our office. We would love to see you. That is my specialty. I love working on the head, the neck, and the jaw. And we can also do a little bit of adjusting of the sinuses, especially right now when we have allergy season. It can be really helpful. So thank you so much for listening. Y'all have a great day.